This presentation assignment is about discharging someone from the hospital who has diabetes with an infected foot wound, asthma, and dehydration. I will do education on the medications this person is discharged with. Wound care will be taught to this patient. The discharge will discuss activity and diet education for this patient. Finally, this presentation discharge will discuss follow-up instructions for this patient. Diabetes is a disease marked by high blood sugar readings. This may also present in an elevated hemoglobin A1C level. This test looks at your blood sugar over a more extended period. A diet high in sugar and carbohydrates, along with being overweight, is a risk factor for diabetes. You must check your finger stick 4 times a day, once before each meal and at bedtime. Please log these numbers and bring them to your doctor so they can evaluate and treat as needed. If you're feeling sick, checking your blood sugar as needed is important because it may be too high or too low. Asthma is a chronic inflammation of the airways marked by the narrowing of the airway. Triggers like illness and allergies cause this narrowing and sometimes exercise. Symptoms include wheezing, shortness of breath, coughing, or chest tightness. Family history and allergies are risk factors for asthma. It is important to keep your rescue inhaler with you and be aware of asthma triggers to maintain asthma control. Dehydration happens when you don't have enough water because you are not drinking enough or losing fluids due to medication use, diarrhea, or vomiting. When your blood sugars are high, this puts you at risk for dehydration. Drinking plenty of water or no sugar drinks will help you stay hydrated. Infection is when bacteria invade spaces that should be clean in your body. Anytime you have an open area from wounds, you are at risk from infection. Diabetes puts you at even higher risk of infection because it weakens your immune system. High blood sugars put you at high risk of infection because bacteria love sugar. It is important to use alcohol to clean your skin when checking your finger sticks or administering insulin. It is also important to keep your wound dressing clean and dry. If the dressing gets saturated or wet at any time, it will need to be changed because if fluid gets in, bacteria can get in. You're going to need to do wound care twice a day. Get all the wound care supplies together on a clean surface like a paper towel. Remove old bandage. Clean the wound with soap, water, normal saline, or wound cleanser. Pat dry. Apply normal saline soaked gauze to the wound bed. Cover with dry clean dressing and secure with gauze wrap and tape. Make sure it's not too loose or too tight. Avoid applying pressure to the wound. Keep it covered, clean, and dry, and change the bandage when it becomes soiled or wet. You will be discharged with the following medications. Albuterol inhaler. Take 2 puffs every 4 hours as needed for wheezing or a chest tightness. This medication is your rescue inhaler. It is important always to have this available. Side effects may include rapid heartbeat and jitteriness. Insulin glargine, 10 units subcutaneously at bedtime. This is your long-acting insulin, and it works best when taken at night and works over 24 hours. This medication may cause low blood sugar. It's important to monitor your blood sugars. Metformin, 850 milligrams orally twice daily. This medication will help control your blood sugar. It can lead to hypoglycemia, so it's important to eat with this medication and check your blood sugar regularly as it is needed if you feel sick. Linzolid, 600 milligrams by mouth every 12 hours for 10 days. This is your antibiotic. You must take this medication as prescribed and finish the prescription. This medication may cause allergic reactions, so contact your doctor immediately if you have trouble breathing, rash, or hives. Percocet, 5 milligrams times 500 milligrams orally 3 times a day is needed for pain. This is your pain medication. It's an opiate painkiller, so do not drive or operate heavy machinery while taking this medication. It may cause drowsiness and itching, so take the smallest, most effective dose. Promethazine, 25 milligrams by mouth every 4 hours is needed for nausea. This medication is an antihistamine, which is also used to treat allergies. This medication may make you tired, especially when you use it with the opiate painkiller, so be cautious. Insulin Lispro sliding scale as follows. 70 to 130 is 0 units. 131 to 181 is 2 units. 181 to 240 is 4 units. 241 to 300, 6 units. 301 to 350 is 8 units. And 351 to 400 is 10 units. Call your doctor if your finger stick is over 351 because you may need more insulin. This will be done after checking your finger stick 4 times daily before breakfast, lunch, dinner, and bedtime. There is a risk that your blood sugar will be too low after administering this medication, so you must recheck your finger stick if you feel sick. You will need to keep pressure off the wound as much as possible. If it's necessary to walk, use air boot and crutches until wound is healed. You will need to eat a diabetic diet. This will include limiting carbohydrates, avoiding the use of sugar, and eating a healthy, balanced diet. Substitute sugar with sugar substitute, and drink diet soda, avoiding sugary juices and foods. Eat whole grains, proteins, and vegetables. Some fruits are high in sugar, so monitoring your blood sugar will be essential. Follow up with your primary doctor within 10 days of discharge from the hospital. Follow up with your endocrinologist, who will follow your diabetes in 1 month. Bring your finger sticks results with you. Follow up with your wound care doctor in 1 week to monitor your wound's progress. Call your doctor or seek emergency care if you're experiencing uncontrolled diabetes, fevers over 101.2, shaking, chills, or profuse sweating. If you have any questions, call your primary doctor and they can guide you. Your medications have been e-scribed to the pharmacy. Call the hospital if there are any problems obtaining the medications. Now you understand diabetes, asthma, dehydration, and infection. We have discussed wound care, medications to take, when and how to take them. We have discussed your diet and activity regimen. You will follow up with your doctors as discussed. Do you have any questions?